Before I introduce our presenters, let me give you a brief introduction to the Alliance and our Let's Talk About Lupus program. Just so you know, we'll have presenters of Dr. Jorge Sanchez Guerrero and Leticia Ocana joining us today as presenters. The National Alliance for Hispanic Health is known as the premier science-based and community-driven organization that focuses on improving the health and well-being of Hispanics and works with others to secure health for all. We work to ensure that health incorporates the best of science, culture, and community. In July of 2016, the Alliance received funding from the U.S. Department of Health and Human Services, Office of the Assistant Secretary for Health, Office of Minority Health under the National Health Education Lupus program to conduct the Let's Talk About Lupus, Hablamos del Lupus National Health Education Lupus program in Hispanic Communities project. The project itself looks at the problem that Hispanics are twice as likely as non-Hispanic whites to have lupus. Yet awareness of the condition, including its signs, symptoms, and the value of early diagnosis is not well known in Hispanics. Compounding this issue is the lack of access Hispanics have to services and the lack of knowledge of some healthcare professionals in how to provide services to Hispanics. To address these disparities, the Alliance established the Let's Talk About Lupus, Hablamos del Lupus National Health Education Lupus program in Hispanic communities to increase Hispanic community awareness and knowledge about lupus, connect individuals to services in their community, and advance healthcare practitioners' knowledge on diagnosis and treatment to improve outcomes for those with lupus. The Alliance designed the program to focus on 3 key areas identified in the research to increase early diagnosis and improve the management of lupus. These are: increase awareness and actionable knowledge, support navigating the healthcare system, and enhancing the quality of care. To meet the goals of the initiative, the Let's Talk About Lupus effort is partnering with local, national, public, and private agencies to expand program reach and access to lupus resources. Leading community-based organization partners will coordinate efforts to disseminate resources to community members and partners as well as professionals in the region. Our presenters today are Dr. Jorge Sanchez Guerrero and Leticia Ocana. Dr. Sanchez Guerrero is a rheumatology division chief for both University Health Network and Mount Sinai Hospital. Born and raised in Mexico, Dr. Sanchez Guerrero received his medical degree from the University of Guadalajara and trained in internal medicine and rheumatology at the National Institute of Medical Sciences and Nutrition. He completed a master's degree from Harvard Medical School and finished postdoctoral training at the Brigham and Women's Hospital, a teaching affiliate of Harvard. Dr. Sanchez Guerrero currently oversees several clinics, top-tier specialist, and inpatient unit care for patients from across Ontario with complex rheumatic diseases. With his main area of research being connective tissue diseases, Dr. Sanchez Guerrero is targeting lupus, measuring its causes, and breaking down how to best diagnose and treat the diseases. Our second presenter is Leticia Ocana. Leticia is a bilingual health educator at the Lupus Foundation of America's national office. She is a seasoned health professional with experience implementing health education programs in the areas of skin and breast cancer prevention, tuberculosis, and diabetes self-management. Leticia holds a Bachelor of Arts degree in psychology from Stanford University and received her Master's of Public Health degree from San Diego State University Graduate School of Public Health. Welcome to both of you. Dr. Sanchez, if we could begin with you.
Yes, thank you so much for the kind introduction and especially for the kind invitation. It is a real pleasure and honor to be involved in supporting the health of Hispanics population in the United States. So, and also I would like to thank the Lupus Foundation of America for extending me this invitation. So basically, the topic I'm going to talk about, it is about the lupus in Hispanics. And so let me see, let me get my first slide. Okay, so these are the topics for discussion I will address. The first is what is lupus? Then, why the diagnosis of lupus is sometimes so difficult, and even this happens among rheumatologists. What are the characteristics of lupus in the U.S. Hispanics? Then, I will focus on the experiences of healthcare professionals when diagnosing lupus in Hispanic patients. What are the most common misconceptions of Hispanics about lupus erythematosus, and what are the questions important to ask to Hispanic patients about possible signs and symptoms related to lupus erythematosus. What is lupus? As we all know, lupus is a chronic autoimmune disease that may involve any organ of the body, and this is one of the major challenges imposed by the disease for early diagnosis. Another issue is that the conception and the reality is it affects predominantly young women. However, people should be aware that also men are affected by this disease, and it is not just young people, but any individual of any age may develop the disease. Why is the diagnosis of lupus so difficult, even for rheumatologists? The issue is that lupus may present in many different ways. Sometimes it presents as multisystemic disease. Some others it presents as monosymptomatic disease. And even with multisystemic presentation, the organs involved may be different. We may see two patients the same day with lupus, and they may have a different combination of manifestations. Even more, a challenge for early diagnosis is that the patient always starts with a first manifestation, and a few days, a few weeks later, presents with the second manifestations. Therefore, early after the onset of the first manifestation, it is difficult to suspect that the patient may be developing lupus, since we may consider that probably the patient is presenting with a hematological disease, with a cardiovascular disease, with a renal disease, and therefore is not referred to a rheumatologist. Also, it is challenging when you have a patient in hospital as compared to as an outpatient, because in hospital, patients who might attend the emergency department may present with multisystemic manifestations due to sepsis, due to cancer, due to other health problems that basically involve systemic manifestations, and that's a real challenge because very often we find patients who may have diverse manifestations suggestive of lupus erythematosus, but actually they do not have the disease. On the other side, there is a subgroup of patients who may start with just one manifestation. It is not unusual to find young female who may be attended because of nephrotic syndrome, and it is after the result of the renal biopsy is available when we find that this nephrotic syndrome may be due to lupus erythematosus. Or females who may have recurrent fetal losses, And finally, the etiology of these recurrent fetal losses end up being antiphospholipid syndrome. However, when we request an extensive panel of antibodies, it is when we find that it is not just the antiphospholipid antibodies, but many other antibodies, and the patient is developing lupus erythematosus. Or it is well known that patients may be diagnosed with thrombocytopenic purpura several years ago, and a few years after start developing other multisystemic manifestations. And this is when we realize that thrombocytopenia a few years ago was probably the first manifestation of systemic lupus erythematosus. So these are the challenges in terms of the clinical symptoms, and this is why it is necessary having the serology available for the assessment and diagnosis of these patients. What about the characteristics of lupus in Hispanics? Well, first of all, let me just mention that in the U.S., the term Hispanic describes anyone whose origin goes back to a Spanish-speaking country. However, we all know that Hispanic is not an homogeneous racial group, and there are many genetic, cultural differences, as well as different problems that we may all face. The prevalence of lupus in Hispanics in the United States is not well established because there are very few studies about that. However, in a very recent study conducted in Michigan 2 years ago, it was found that overall the prevalence of lupus in Hispanics is around 33 per 100,000, and as is known in other populations, females is the group predominantly involved, and in females, the prevalence is over 70 cases per 100,000. However, males is also about 15 cases per 100,000. What are the characteristics of lupus erythematosus in Hispanics? And this is participating in multi-center and multinational studies with different ethnic groups. It is known that lupus in Hispanics starts at a younger age. Also, when they start, tend to have a higher disease activity. Hispanic patients tend to develop chronic damage much faster, and very frequent they have involvement of major organs such as the kidney, the CNS, or hematological manifestations. On top of that, in terms of comorbidities, it is known that the Hispanic populations most often develop obesity, diabetes, metabolic syndrome, and hypertension as compared to other ethnicities. What are the experiences that health professionals have in terms of diagnosing lupus in Hispanic patients? And here I should mention that for over 25 years I practiced in Mexico City at the largest center of rheumatology, and we had an active lupus population of 2,000 patients. At first, and this is something that happens almost with every single patient, the patient denies or tends to deny the diagnosis or raises doubts about this. Also, it's the autoimmune diseases in general, and particularly lupus erythematosus, very frequently is a disease unknown for the patients. So sometimes the first time they hear about this diagnosis is when they receive this diagnosis or when they are in clinics. Something else is that in Hispanics, we tend to be familiar with acute diseases, but not with chronic diseases. In terms of the explanation or the etiology about why I did develop this disease, very often they tend to give magic ideas or have magic explanations for the development of these diseases. One of the challenges we face across all lupus patients, but particularly among Hispanics, is the poor compliance. And poor compliance for different reasons is lack of access to medical services, might be, but even those who have full access to medical service, the compliance frequently is not optimal. They are poor compliant with the consults, with the treatments, and with general recommendations such as avoiding sun exposure. Something else is that patients may follow the indications as well as the treatment while they are experiencing symptoms. However, once the disease is in remission or is under control, is difficult, is challenging that the patients will be following a chronic treatment. Patients are feared about the use of prednisone predominantly, as well as immunosuppressants. And something else is the influence of the family. The family influence is very important in the Hispanic population, sometimes for good because you have family support, but also very often the decisions about the particular patient are taken within the family. I'm trying to move to the next slide. So, which are the misconceptions that Hispanics may have about lupus erythematosus? One, as I mentioned before, is that lupus affects only young women, and therefore is very challenging when you make a diagnosis to a man or in elderly populations. Also, there is the hypothesis that there is an infectious etiology, and patients consider that this is a chronic infection and should be treated as such. The other is very often is about nutritional factors, and nutritional factors quite often patients tend to, in addition to the regular medications, follow different receipts that are given by the family or friends. Another misconception is that having a positive ANA means that the patient has lupus, and this is very challenging considering the very low positive predictive value of ANA. Once a female is diagnosed with lupus erythematosus and she accepts the disease, then they are afraid about the transmission of the disease to the children, and they frequently ask about the need of testing for different antibodies in the children. Also, they consider that pregnancy is contraindicated when nowadays in properly selected patients, pregnancy is successful. Something else is that once the diagnosis is made, patients tend to explain any symptoms, any complaints they have to lupus erythematosus. And finally, they are not aware that the proper control of the disease and even the remission is possible. What are the questions important to ask in terms of symptoms and signs for diagnosis of lupus or diagnosing a flare of lupus? I have found through all the years of practice that it is very important to ask very clear and straight questions to the patients, but most importantly is listening careful to the patients, because patients tend to explain the symptoms and the concerns and complaints in their own words, and this is obviously influenced by own culture. Other than that, I mean, I don't think that we need to do something different than that in order to assess the disease, either for diagnosis or related to disease activity. The last slide I would like to show, this is a slide that I found in an article probably 15 years ago in the Lupus Journal. And this is a map of the U.S. These are all the counties in the U.S. and showing the variability in the geographic mortality due to lupus erythematosus between 1984 and 1993. As you may see here, there is a large heterogeneity in the prognosis of lupus erythematosus across the different counties in the U.S. And I think that this reflects not just the mortality, but also the ability to diagnose lupus, the ability to take care of lupus patients. And I think that this basically reflects what is the reality in patient care. This is my last slide, and again, I would like to thank the invitation, and at the end, if there is any questions, I will be happy to answer.
Thank you very much, Dr. Sanchez-Guerrero. And as we said before, we'll reserve the questions for after. Next up would be Leticia Acana from the Lupus Foundation. Leticia. Can you hear us?
Yes, I can. Good afternoon, everyone. As Kevin mentioned earlier, I am the bilingual health educator for the Lupus Foundation of America's National Office in Washington, D.C. And one of my main responsibilities is to respond to the Spanish language inquiries that we receive. It is my pleasure to share with you some of my observations from responding to the inquiries, some of the techniques and resources for communicating with the Spanish-speaking Hispanic population about lupus. So during my presentation, I will provide you with a brief overview of the Lupus Foundation of America, provide a snapshot of the Spanish language inquiries that I respond to, talk about Hispanic cultural norms and the provider-patient relationship, share some of the concerns that I hear from Hispanic patients after they have been diagnosed with lupus, and share some techniques for discussing lupus diagnosis with a Hispanic patient both before and after diagnosis. So what is the Lupus Foundation of America? It's a national organization founded in 1977. The vision of the organization is a world without lupus. The organization will advance the science and medicine of lupus to find a cure and improve the quality of life for all people affected by this disease. The mission of the foundation is to improve the quality of life for all people affected by lupus through programs of research, education, support, and advocacy. And we are able to accomplish this through our national network, which includes not only the national office, but state chapters, regional offices, community partners, board members, and the Medical Scientific Advisory Board, of which Dr. Jorge Sanchez-Guerrero is a member. So last year, our small team of health educators responded to 4,536 inquiries, and 582 of them were in Spanish. That's approximately 13% of the total number of inquiries. To date, I have personally responded to approximately 800 Spanish language inquiries. So what's the method of contact of these inquiries? How do we receive them? As you can see here, the vast majority of the inquiries, 497, were sent to us via the web. Individuals logged into the Foundation's website and sent their inquiry by completing a Contact the Health Educator form. A smaller number of inquiries came to us via direct email to the organization and via a direct telephone call. And so where do these Spanish language inquiries come from? As you can see, the majority do come from within the United States. I also responded to 7 inquiries from Mexico, and also received 45 from Colombia, 35 from Argentina, 27 from Chile, 22 from Spain. And other Latin American countries sent a few inquiries each, totaling 95. So what are the common topics addressed in the Spanish language inquiries, keeping in mind that one inquiry can cover several topics. So you can see here, understanding lupus is a popular topic, which includes general information on lupus, triggers causing lupus, and genetics. Treatment is the most popular topic and includes general information about general treatment information, as well as questions regarding complementary and alternative medicine. Resources is another frequent topic and includes medical and financial assistance and physician referral. Living and coping with lupus it includes questions about flares, photosensitivity, pain, pregnancy, work, diet, depression, fatigue, hair loss, and many other aspects of living with the disease. And finally, diagnosis, which includes general information about diagnosing and laboratory tests. Oops, take me back to pardon me. So I'm going to talk briefly about Hispanic cultural norms that affect the patient-provider relationship. Recognizing and addressing these cultural norms can have a positive impact on getting to an early diagnosis and later with treatment adherence once the diagnosis is made. These are things that I keep in mind in my communication with Hispanics, and you may recognize some of these norms from your interactions with some of your own patients or your patients. First on my list is respect, and Hispanic patients have a great deal of respect for medical providers. They don't question the provider's authority, they don't question what they're being told, and if they disagree, they may not say so. They may feel a sense of shame for not understanding what the provider is telling them, and as a result, they may not ask follow-up questions. Therefore, the provider may need to probe a little bit further if the patient is not forthcoming with answers. One way a provider can show respect is to use the term señor or señora when addressing an older patient. And when appropriate, I certainly use these terms during my calls. The second cultural norm listed here is politeness and formal friendliness. Hispanic patients expect to have a friendly, polite interaction with the provider. To achieve this, providers may shake hands or ask the patient about his or her family or try to speak Spanish or speak Spanish. This can help increase satisfaction with the medical appointment and may increase the likelihood that the patient will follow through with the provider's recommendations. Uncertainty avoidance refers to the belief that there is little one can do to alter one's fate. This may affect health-seeking behavior, such as delaying seeing a doctor until symptoms worsen. It is important that providers emphasize that the patient has a role in their own care and emphasize that treatment is available if a lupus diagnosis is suspected or confirmed. And strong family values. Hispanics embrace strong family values and may bring members who may be speaking for them or helping them make decisions. Providers should have a balance between engaging family members and empowering the patient. And I am often responding to or talking to a family member of someone who has lupus. So how does the foundation help individuals who are concerned that their symptoms could be caused by lupus? We aim to empower them to take an active role in getting to a diagnosis sooner than later by preparing them for a medical appointment. We recommend they organize their medical history, keep a journal of their symptoms, and to be as specific as possible, and talk about the first problem that worries them the most. We ask them to anticipate what the doctor may ask them and would offer some sample questions, such as, where is the pain most severe, where did it start, and does anything trigger it? And of course, have their responses ready. We also recommend they bring prescription and non-prescription medications and any vitamins, herbs, minerals that they may be using in their original containers to the medical appointment. We recommend they have their medical appointment records ready and that they ask for a verbal summary. We advise them to prepare their questions. They will ask the doctor, and when talking to a Hispanic individual, I make sure to emphasize this point and let him know that this is okay to do so and that some doctors expect them to ask questions. And we also provide them with some sample questions, such as, will further testing be needed, and what is the problem likely to be among the possibilities? Oops. Okay, back here. So conveying the message of the value of early diagnosis. In addition, we stress the value of getting diagnosed early, and the methods we use include discussion to increase the awareness of the disease and symptoms. I also talk about lupus being more common among Hispanics. Our message is to see the doctor if they suspect lupus, and as you saw, prepare them for the visit. We emphasize that early diagnosis and proper medical care are the best ways to manage lupus. And we ask them to pay attention to what's going on with their body, to look for other symptoms that may or may not be related to lupus. As far as resources to help us convey the message, the Foundation produces educational materials to help people through their journey to diagnosis, such as the Could You Have Lupus tear-off sheet. This is a two-sided sheet that includes a series of questions regarding possible symptoms under each of the major systems and instructs the reader to follow up with their doctor if they have had any or several of the symptoms. The backside of this sheet, titled Facts About Lupus, includes information about the types of lupus, the causes, the diagnosis, and offers recommendations on living with lupus. It is one of the best tools that we've heard that people with lupus use, and is currently being translated into Spanish as part of a collaboration between the Lupus Foundation of America and the National Association for Hispanic Health. Hispanics and Lupus is a quick guide that the Foundation produces and is another Spanish language resource for raising awareness about the disease. It includes facts about lupus and Hispanics, provides information on what lupus is, types of lupus, symptoms, causes, treatment, diagnosing, and living with lupus. But this guide also addresses the use of herbs, supplements, and folk medicine, which is culturally appropriate for this group. This guide is also available in English and is suitable for Spanish-speaking Hispanics. This is the inside of the guide. And the back side includes recommendations for those living with lupus. So what are some of the concerns that I hear from the Spanish-speaking callers once they've been diagnosed with lupus? And you will see some of this information Dr. Sanchez Guerrero covered in his presentation. One is they don't know that the disease is a chronic disease or understand what that means. One question that I repeatedly receive is, how can I cure my lupus? They don't know the possible causes, and another common question is that we get is lupus sexually transmitted? They don't understand the manifestations or symptoms of what can happen. They also express concern over the accuracy of the diagnosis and question whether they are on appropriate treatment. And they express fear of the future and becoming disabled, being able to access medical care, and whether they're going to pass this on to future generations. So some techniques for discussing a lupus diagnosis with a Spanish-speaking patient includes giving a verbal summary, whether you suspect lupus and further testing is needed, or if you've arrived at a diagnosis. A verbal summary helps inform the patient. Not appearing rushed addresses the Hispanic patient's cultural norm of politeness and professional friendliness. It is not uncommon for me, and I have the luxury of being able to spend up to an hour talking to an individual who suspects lupus or has been newly diagnosed with the disease. I also offer to mail a packet of information to reinforce what was discussed during the communication. We also ask if the information is clear and offer materials. For the Hispanic patient, it's important that providers show interest and concern and stress the fact that lupus can be treated. And this can help counter the belief that there's nothing they can do to improve the disease outcomes and offers hope. Engage the patient in their care, emphasize the important role they have, and encourage them to work alongside you. Asking the patient to keep a journal of their symptoms or side effects helps them take an active role and also may counter the belief that there's nothing they can do to alter their fate. The resources for discussing a lupus diagnosis with a Hispanic patient, the Lupus Foundation of America has several chapters, and they can offer educational materials, support groups, where you can refer your patients to the national office, and we can provide them with an informational packet, and also they can speak with me, a bilingual health educator. Here's some images of a few materials included in the informational packet. Impact on the Body is another resource available that discusses in a very visual way how lupus may affect the body. And the backside includes facts about lupus. Additional resources in Spanish include frequently asked questions on the Foundation's website, www.lupus.org. We also have 10 Ask the Experts podcasts that include a short 10-minute audio with PowerPoint slides that folks can follow along, and 15 questions and answers that the expert responds to. And some of the most popular podcasts, and certainly that I refer patients to in inquiries, are Diagnosing Lupus, and the presenter there is Dr. Sanchez Guerrero, and General Management of Lupus. These are the top two podcasts. And finally, the National Resource Center on Lupus, which is currently under development and expected to go live in March. It will be a living source of information, empowerment, and support for anyone with questions about lupus, including people with lupus, caregivers, children and teens with lupus, and healthcare providers. And this resource center is made possible by the CC grant and will also include additional Spanish language information. And with that, I thank you for your time and attention.
Thank you very much, Leticia. I really appreciate that. We all really appreciate that. And we do have a few questions that have come in. First of all, I noticed that one question that has come in, and it's regarding will the slides be available to all? Yes, they will be available to everyone. In fact, we are recording this entire webinar, and we'll make that available to any of the registrants that would like to see them. We'll send out an email with that link later. Okay, there are several questions. I believe this one is for Dr. Sanchez Guerrero. Can you talk about the effectiveness of stem cell therapy to treat lupus and where to get this treatment?
Well, stem cell therapy, it's an experimental therapy. So there is not a therapy that is available right now in clinical practice. So even this is on experimental phases only. I am aware that several patients have mentioned to me about offering stem cell therapy for treating lupus. However, there is not like an accepted therapy at this moment.
Okay, another question regarding that. How effective is Benlysta in treating lupus, and are there any long-term risks?
Well, I'm going to start answering the second part of the question about long-term risk. There is a publication about 5-year follow-up of patients treated with Benlysta, and basically it shows that the treatment is safe. This is after 5 years of treatment. How effective is Benlysta? Well, basically Benlysta, the trials that were done is to treat general lupus patients, mostly patients with mucocutaneous manifestations and articular manifestations. And in those two types of manifestations, it is where Benlysta showed to be effective when added on top of the standard of care of patients. Something that I find, obviously, is that Benlysta has not been tested head-to-head to different immunosuppressants on early manifestations of lupus erythematosus. This is an information that is not available yet. I know that there is an ongoing trial on lupus nephritis. However, one of the problems is that most often patients who have refractory manifestations to standard of care are the ones who are started on Benlysta, and this is kind of unfair for the product because refractory patients means patients who have failed to other therapies. I think that in general, Benlysta is effective in patients in whom the doctor, the lupus doctor, has analyzed the clinical manifestations, the characteristics of the disease, and decides that the patient may fit within the spectrum of benefits given by Benlysta.
Very good. Thank you for that. Our next question is, The person says, I understand that a woman can still have children while having lupus, but are there any difficulties in relation to lupus during a woman's pregnancy or no?
When a woman with lupus wants to get pregnant, basically we ask these patients to be in close contact with us before deciding about the pregnancy. We need to be sure that the patients have had the disease inactive at least 6 months, but the longer the better. That's first. The second, in addition to being on low disease activity or even a remission of the disease, patients should be on very low dose of treatment. This includes prednisone, 5 milligrams or less, as well as treatment with Plaquenil or azathioprine. I mean, those are allowed. So yes, patients may do very well during the pregnancy if they are properly controlled of the disease, if they are on low dose of prednisone, and also, it's better if the patients are negative for antiphospholipid antibodies. During the pregnancy, when the patient is pregnant and the patient starts after these previous considerations were met, in general, the prognosis of the pregnancy, I think, is favorable.
Very good. Thank you. The next question, is there scientific evidence about the use of Is there scientific evidence about the use of supplements that could benefit lupus patients?
No, there is not evidence about any supplement that is proven to be helpful in the treatment of lupus patients. However, about 20 years ago, there were different clinical trials, big clinical trials in patients with rheumatoid arthritis who receive omega-3 as adjuvant on top of the regular treatment, the standard treatment for rheumatoid arthritis. It was found that the use of omega-3 did not have major influence in the symptoms of rheumatoid arthritis. However, when the inflammatory markers were analyzed in the group receiving omega-3 versus placebo, it was found that the group receiving omega-3 had lower levels of inflammatory markers. The conclusions from those studies were that its use of omega-3 may have a good effect on inflammation, but is not enough for the treatment of rheumatoid arthritis. And I think that this knowledge may be extrapolated to lupus erythematosus.
Now, we received 2 questions from one person. I'm going to kind of combine those because they relate to one another. First of all, she says, what physicians diagnose lupus, and why is it so difficult to diagnose lupus? And the reason she asked this is because she has a young lady who was diagnosed with lupus by one doctor, and then she was told by a different doctor that instead of lupus, she had rheumatoid arthritis, and she is very confused.
Yes, one of the challenges we face in lupus erythematosus is that there is not like a gold standard for that. And especially very early in the disease, patients may have, as I mentioned during my presentation, may present just with one symptom. In this case, might be arthritis. And patients may be misdiagnosed either with rheumatoid arthritis or with lupus, and the patient ends up having another diagnosis, another related diagnosis. This happens to everyone, even in major lupus centers. Sometimes it is difficult to confirm the diagnosis of lupus early during the course of the disease. However, I think that patients should understand the challenges that this imposes, and it doesn't mean that the patient should probably move to another physician, but probably, I mean, I think that having a second opinion or even a third opinion is valid, but this is because of the overlap of symptoms across all these diseases.
Okay, our next question is, what is ANA?
ANA means anti-nuclear antibodies. Anti-nuclear antibody is the first test to be performed in patients with lupus erythematosus. The reason is because this test is positive in almost every patient with lupus. About 98% of patients with lupus have positive ANA. However, these anti-nuclear antibodies is not exclusive of lupus erythematosus. It may be found across many other autoimmune diseases or even non-autoimmune diseases. Even more in the general population, people may test positive for ANA. So that's why having positive ANA doesn't mean that the patient does have lupus. The positive predictive value, once the test is positive, that means what are the probabilities of a patient or a person may end up having lupus once she tests positive for ANA is around 15%. That means that the probabilities are 85% of not having lupus after testing positive for ANA. Now, if the ANA is positive, in the context of symptoms and manifestations suggestive of lupus erythematosus, and after the first result, the patient is tested for additional antibodies, and these antibodies come back positive, so the probabilities or the certainty of having lupus increase significantly.
What are the best medical tests to diagnose lupus?
The best medical test is the medical history and the physical exam.
Okay. And what is the life expectancy of a patient with lupus while undergoing treatment?
Right now, I mean, the expectancy of life in lupus erythematosus has improved significantly. In the past century, around the 1950s, the expectancy of life at 5 years was about 50%. Nowadays, at 10 years, it's close to 90%, and even at 20 years, it's around 80%. So I think that now the diagnosis of lupus is made faster, earlier, easier, and also there are many lupus-specific treatments as well as many other treatments that are related to the control of lupus erythematosus that have been very helpful on improving the prognosis of the patients.
Okay, our next question is, I have been suffering from thrombocytopenia since
Thrombocytopenia?
Thank you. I apologize for if I mispronounced that. Since I was a child and have never received treatment or been told about lupus. Since you mentioned this, can this be a question for my doctor?
Thrombocytopenia is a manifestation of lupus erythematosus, but also is a manifestation of several other diseases. Sometimes thrombocytopenia is a disease by itself, and this is like not a frequent but not unusual manifestation or unusual disease. Having thrombocytopenia doesn't mean that the patient has or will have lupus erythematosus. However, what I meant during my presentation is that some patients who end up having lupus erythematosus may have as the first and early manifestation thrombocytopenia, and after several years of being diagnosed as a disease primarily of the platelets, develops other symptoms that basically that's when the diagnosis of lupus is discovered.
Okay. When someone is diagnosed with lupus, what are some of the dietary recommendations or restrictions?
Well, fortunately, there are not many recommendations. I think that in general, the patient should follow like a healthy diet. That's first. The second is that in addition to the lupus, patients need to be careful about having a normal glucose, normal lipids levels, and therefore it is important having a diet well balanced and trying to avoid any nutritional factor that may affect the glucose as well as the lipid levels. Now, this is in general terms. Specifically, whether having one diet or another type of diet will benefit the disease activity or will benefit or may get worse the disease activity, it is not the case.
Okay, and as a follow-up, one person actually said that people keep advising me about products, food, or diets that make the immune system stronger. But as I understand, the main treatment for lupus is to weaken the immune system. So are these things that make the immune system strong or can help or make lupus worse?
No, I think that having a balanced diet to improve the immune system doesn't affect the lupus activity. The weakening of the immune system, which is also known as immunosuppression, it's an effect that is found with the treatment that the doctor prescribes. Now, how weak the immune system needs to be in order for the lupus to get under control, this is something that should be led by the physician in charge.
Both presenters. Here's one for both presenters. Could you talk about the typical profile of the patient that has questions, actively seeks for treatment about lupus? They continue saying, we find that most of our uninsured community will be reluctant to go to the doctor and will most likely get treated for some of the peripheral symptoms of lupus, but will not ask directly about the disease because of fear and monetary concerns.
Leticia, do you want to start?
I'm not sure I understand. The question is what?
They basically want to know what the typical profile of a patient is that has questions or that actively seeks treatment about lupus.
Well, I would say maybe it's a patient that perhaps has a number of symptoms, unspecific symptoms for a long time, fatigue. Sometimes folks will talk about having fatigue and pain for several years, but they will dismiss it as part of because they have a job. Let's say they are in maintenance, and it's very exhausting, and that's how they dismiss the symptoms. Or sometimes they will have a family member who encourages them to seek medical attention because the symptoms have been going on for many years.
Thank you, Leticia.
Okay, so my impression is that basically Usually when a patient comes to a rheumatologist or the diagnosis of lupus is suspected, unfortunately, I mean, the patient has had these symptoms for several weeks, even several months, and it is only when probably multisystemic, it is recognized that the patient is presented symptoms at different organs and systems when the suspicion of lupus is raised. And so I think this is very common. This is like the profile of the patients.
Okay, we also have another question for Leticia. We're also almost out of time for the webinar. So anyway, for Leticia, do you provide referrals to rheumatologists or other professionals in lupus that speak Spanish?
Yes, we can. I mean, I do a search for Spanish-speaking rheumatologists. They are difficult. They're to come by, but I can assist any caller with identifying a provider that can speak your language, certainly.
Great. Thank you. We have, I believe we are out of questions now, so I appreciate everyone joining us today, and I appreciate the presenters, Dr. Sanchez Guerrero and Leticia Ocaña. For presenting today. Both of you have been really great, and I appreciate your time and attention to this and helping us with our webinar. Thank you all for joining us. And we will have a recording of this available for everyone.
Okay, thank you so much.
Thank you.
Bye.
Thank you.